My gosh, it is Sunday night, and that means it's Sunday night service. And man,
Woohoo!
do I have a treat for you all. Methylene Blue. This is Dr. Scott Shearer here. Scott
Hey,
Shearer
Danny.
here. And we are going to be talking about the power of methylene blue and why you would turn your tongue blue. But as soon as you all get on here tonight, I want you to hit your heart buttons, hit your like button, share it, tell us where you're from, and put your questions up here, and we will try to get them all answered tonight. But here's the thing. Did you know that methylene blue actually came about like in the 1800s as a
Hmm.
textile dye
It
to
did.
dye textiles? So the same methylene blue that we're talking about was originally used to dye your textiles and your blue jeans. Who in the world? I mean, how in the world? So, how did we go from dyeing blue jeans to realizing that, holy cow, this methylene blue dye could be a real mitochondrial boost, maybe for viruses or depression or dementia, Alzheimer's use, cancer, COVID, which of course we wouldn't have known back about that in the 1800s,
Hmm.
um, cognitive decline, pain, focus, energy, clarity, so many things. So,
Indeed.
am I right?
Yeah, I mean, it's unclear exactly how we got from a textile dye, blue jeans, to a treatment initially for malaria. So back in the 1890s, it was the first antimicrobial available. So it was an antiviral, it was an antifungal, it was antibacterial, concentrated in the urine. So you urinate blue when you take methylene blue. And that's just a fun side effect, for a benign one for people that are taking methylene blue. And so they knew for a while that it really was working on those antimicrobial ways, but we didn't know how it got from like textiles to malaria. Maybe psychedelics, I don't know. Maybe it was down in South Africa. So what do they do in South Africa in the 1890s? I don't know the history, but whatever it was, that's how they figured out malaria. And then over like 100 years, because it was first approved as a drug by the FDA, our FDA, in 1897. It was over that 100 years we realized that it did all these amazing things at the cellular level. It had the ability to really optimize the key, it's called your organelle, the key part of your cell called your mitochondria that help you make energy. So
Okay.
as we know, diseases of aging are diseases of the mitochondria. And these are the things that you described: dementia, autoimmune problems, inflammatory issues, chronic fatigue syndrome, fibromyalgia. All of these things go back to mitochondrial function. So if you can optimize mitochondrial function, you can make energy more effectively. And then at the same time, you're not only making energy more effectively, you're helping actually increase your antioxidant reserves. So the key for everybody to remember is when you make energy, there's no such thing as a free lunch, right? So every time we make energy in our cells, we have these waste products, these products that get built up. And then if these don't get neutralized by the body, they can build up and cause toxicity. And so these are called reactive oxygen species, or oxidative stress, or free radicals. People have heard all these terms before. And so we make energy, we make free radicals. But if you make energy, but also have at the same time the ability to increase your antioxidant reserve, so you're actually neutralizing that, you're optimizing energy and more resilience at the same time. Oh, did I go away? Am
No,
I still
you
here?
didn't. That
Okay.
was me.
Okay. All right. I was like, oh, I'm gone. I'm here. Okay. Anyway, so yeah, so we know for the last 100 years that not only is it a great antimicrobial, not only is it a great anti-inflammatory, but it also optimizes mitochondrial function, increasing your energy and resilience.
It's fascinating. So, guys, there's the little 3-minute primer right there on it. But let me tell you about Dr. Scherer here for a second as
Sure.
well. He's an internal medicine doctor, and he actually is the COO. No, yeah,
Yeah.
COO,
Correct.
right?
Yeah.
Of
Mhm.
Transcriptions, which is a smarter, not harder company. Is that right?
You did
Yeah.
well. Yeah. So our umbrella
Yeah,
company is called
internal
Smarter, Not
medicine
Harder.
doc. He's
Yeah.
also a specialist in HBOT therapy,
Mhm.
hyperbaric oxygen therapy. Holy cow. I didn't realize that either.
Mhm. Mhm.
So he's the real deal. I spent 2 years, 2 days with him.
It felt like
It
two
probably
years.
felt like 2 years for him. 2
For
days
you, I
with
was going
him
to
in
say.
New York City last month learning about this. And when I was at the Integrative Healthcare Symposium, but I cannot wait for you all to listen to him tonight and to learn about the power of methylene blue. But not only methylene blue, they have another product, Trocon, that's got kava kava in it and some GABA and things. But we're going to talk about what is it, why use it, what are the indications for it, right? Do we use it every day? Do you use it as needed? Is this something forever? I don't know. We're going to talk about it. What are the contraindications? Because there may be a few in that. And the way it's what is a troche, and why do we use it as a troche? So let's just let Scott take it away over here.
Oh, I get the player's choice. Okay, Danny, this is your show, wherever you want to start. But
that's right.
But indeed, yes, I'm an internal medicine physician, board certified. I live in Colorado, just outside of Boulder. And my company called Troscriptions, as you said, is the name of the company is a mashup of two words, the word troche and the word prescriptions. So troche is the delivery device that we use, delivery method that we use for our products. And they're these small lozenges that Danny has over here. They're squares and they're scored into little pieces. You can have either a quarter or a half or a full. Danny has it over there so she can show you.
I'm going to show it to you.
And she's got the display over there. And the thing about a troche that's really awesome is that you can titrate it. You can start off with a quarter, a half, or a full, and you can titrate to the dose that you need. It's got child locks on there for the kids, so that's why it's hard to open. But so we use the troche because it actually has a specific quality to it. So there's the troche right there. You see it's scored. It's kind of you can cut into fourths as you need to. So either a quarter, a half, 3/4, or a full, depending on your dosing. And we can get to the dosing in a minute. But the troche itself is really great because it dissolves between your upper cheek and your gums between about 15 and 30 minutes. And when it does that, it dissolves into what's called your buccal or your cheek mucosa. Doing that bypasses digestion. And so when you digest things, it goes through your liver. And when it goes through your liver, it usually gets less active, less bioavailable. And so the issue that we have with a lot of things that we take, and most supplements that we take, about 90% of what we take is actually deactivated or neutralized in the liver. We don't even get to use it. So that's why sometimes, like when you're in the hospital, or I'm not sure if you use IVs in your office, Danny, but a lot of offices will use IVs because of everything's bioavailable if you're getting it in the IV. Right. But but troches themselves, because they're not getting digested, most of the ingredients are almost fully bioavailable or available to your system as soon as you take them. And the nice thing about that is that you don't have to worry about them getting neutralized or inactivated or anything like that. And they also work faster because they don't have to go through that digestive process. I like to tell the story of cannabis edibles. Everybody knows their cannabis edible story, where they take some cannabis edibles. This has happened to me as a kid. You take some, you don't feel anything, and you're like, it's an hour later, I'm going to take more. And then 2 hours later, you can't move because all of that finally hits your system, because it can take a while. If you've just eaten, for example, it can take an hour and a half for you to start feeling the effect of a certain medication or a supplement, for example. So the nice thing about troche is that you don't have to worry about that. You can have them dissolve in your mouth up here. The other part of our name is from prescriptions. So we are as close to a prescription grade as possible with our products. And the reason for that is that I'm a physician, like I said. There's 3 other docs on the team that are also physicians as well. We have Dr. Ted, who's our founder, formulator. Danny got the pleasure of meeting him and dealing with his sex jokes for a little while at our booth. Yes. We do a lot of things with bluing ourselves, as you can imagine, with the color blue. It lends itself to it very easily. Let's just say.
Yes, it does.
But you have more energy for everything, including sexual opportunities, maybe, is what he was trying to allude to, I think. But yes. Anyway, so we have Dr. Ted on our team. We have another guy named Dr. Shaker, who I think you also met, and then Dr. Harry, who's one of our other formulators, very much into the psychedelic world, actually, he personally. So there's 4 of us, and then we all really care that we're making as prescription grade as possible because, Danny, I know you vet your supplements really well at your office because you have to, because you don't really know what you're getting unless you really do some research, because supplement companies don't have any regulatory framework that they fall into. They don't have to do anything. So if you buy something on Amazon, you don't know what you're getting. And in fact, I was just looking at something recently that like 3/4, at least half to 3/4 of what you buy on Amazon is probably fake or probably doesn't have the active ingredients that you want. So we wanted to make something as prescription grade as possible without being a prescription. So you can get it from Danny's office, you can get it from her store, online or the supplement store that she has there. And you can get it without a prescription. Danny's prescription, Danny's saying this is right for you, but not having to worry about getting a prescription from me or something like that, because you don't need a doctor to help you out.
That's right. Yeah, thank you for mentioning that about Amazon as well. Metagenics, which is one of our, of course, I'm right here. Well, heck, anyway, they're one of our big companies.
Yeah.
They ordered about 5 years ago, they ordered $40,000 of their products off of Amazon. They were getting some complaints that things weren't working right or things tasted wrong or what have you. $40,000 ordered their own products on Amazon,
Wow.
right?
Okay.
Fake, expired, rancid products in their bottles,
crazy.
but not their products.
That's crazy.
They shut down 10,000 Amazon stores during that time, but they're constantly trying to shut
it's
stores
whack-a-mole,
down.
man. I mean, that's the problem. They're just
anybody
so big.
can sell stuff on there. It's the wild, wild west. So, you know, if you don't buy it from me, you need to buy it from somebody who's reputable. So yes, that's fact. So that's a little caveat, no,
that's great. That's great. I didn't know that. That's really interesting. And I'm not surprised.
You can buy my book on Amazon. I guarantee it's the real book. It's not going to be anything fake. It's all going to be the real book.
All Danny, all the time.
Paper, your light bulbs. I don't care on Amazon, but don't you dare buy anything you're going to ingest on Amazon.
Yeah, beautiful. Yeah, beautifully said. Yeah. So yeah, please listen to Danny. And this is with my own patients and clients too. I don't have them order anything on Amazon. It's all through either a supplement platform that I trust, or it's through myself personally as well that works. So, but yeah, so I mean, Player's Choice says, do you want to go? But that's the name of our company's name. And that's how we got started.
Excellent. Okay. What is it? Why are we going to use it?
Yeah. So when we were developing products, Danny, what we were trying to do was figure out what are the pain points for people, you know, not only pain itself, but what are the pain points? And so we have a nonprofit organization that you were asking me right before we got on. And we have a nonprofit organization that trains doctors and practitioners on how to optimize health, called Health Optimization Medicine and Practice, homehope.org for short. You can just look at if anybody's interested. So the idea really is that we wanted to we optimize health rather than treat disease, looking at foundational biomarkers, a lot of what you do in your clinic, most likely, Danny, already. But the key for us is that when you're, and this is something that you see in your office all the time and your patients will resonate with, is like you need some help right now as you're doing the hard work of really optimizing your health, which can take a long period of time. It's not like if it took you 50 years to get here, you can't expect that on day one of Danny's program, you're going to feel like you did when you were 25. Like, I mean, and I'm sure you have to manage expectations all the time. And I do, especially in my office.
I say that all the time. You've got 5 decades of dysfunction. That's usually what I say going on here. This is going to take longer than 4 weeks to reverse.
Yeah, exactly.
We're going to get you feeling good quickly, and then we're going to keep building on that.
Right. So on the quicker part, the now part, that's how transcriptions really came about, because we wanted things to help with focus now, with mitochondrial function now, and with relaxation, stress reduction now. And then we have something coming for sleep. We'll have something for pain. We'll have all these other things that we're developing. I'm going to get you some of the sleep ones to try for your office pretty soon, I hope. But in any regard, the first product we came out with was something called Blue Carnitine. I'm not sure if you have that one at your office.
Oh, you bet. This is my favorite.
Oh, it's your favorite. Okay, awesome.
This one is my favorite right here.
Yeah. So the carnitine is a combination.
That's what's on my tongue right now.
Excellent. Wow. You just went dark over there.
I don't know why.
You're getting back. You're coming back.
I'm coming back.
You're coming
I don't
back.
know. I don't know what happened there. I didn't touch anything. That's weird. Okay, keep talking. It's fine.
Yeah. So blue carnitine itself is a combination. You're back. It's all good. So it's a combination of 4 ingredients. One of them is methylene blue that we were talking about. Another one is CBD. Everybody knows CBD, relaxation, stress reduction. It's also protecting the brain, anxiety. It helps with decreasing anxiety. Then we have caffeine. Everybody knows caffeine. And then we have another one called nicotine in there. Everybody's heard of nicotine. People get scared of nicotine, but nicotine in very, very low doses, like we have in our troche, is really great for cognition, for performance, for memory, for recall, for verbal fluidity. And it turns your brain back on. It's like snapping your fingers, really. And if you're using it in very small doses, you're not vaping it or smoking it or using it with the additives that you'd find in those products, it's not addictive either. And so you don't have to worry. It's okay. Now, if you've been a smoker in the past, you may not want to do this just because nicotine does have a feel that some people might remember when they were using nicotine when they were younger. But if that's not the case, then it really has a very low addictive potential overall. So, and this is like, if you want to focus, if you want to get some work done, if you need to get a presentation done, if you need to have a podcast, if you need to really just lock down and do it, this is kind of like taking Adderall without the jitters. Like this is like and people have been able to, I know you've been doing this in your office, Danny, getting people off those ADHD drugs and using blue carnitine instead. And so the full troche is a lot for most people. Usually the dose, what is your dose for blue cannatine? What do you typically use? Is it
I
a quarter,
usually
half?
do a half a troche.
Yeah, so half is the average for most people. So
Okay.
yeah, so half is the average. So for me, I'm a lightweight because I don't drink much caffeine. I'll do a quarter and I'm
Okay.
good. And I'm 3 to 5 hours of really focused, and I just feel
Yeah.
like I can really accomplish anything that I decide I want to do. And
yeah.
you're not as distractible either. You just really are able to kind of like lock in. It's not as bad as, I haven't taken Adderall before, but what I've heard from other people is that Adderall gives you like the jitters. It gives you like really hyper focus. You can't kind of get out of that tunnel vision. Like blue cannatine doesn't do that to you. You're able to get the work done, focus. I know your son's been using it in medical school too. So
He loves it. He has all of his people on it there, yeah, they
yeah,
absolutely love it. And that's what's on my tongue today.
yeah,
I think it's that one's my favorite.
yeah.
I love that.
Right, because people feel it. As soon as you take it, you feel the difference. Within about 15 to 30 minutes,
Yep.
you're going to ramp up and you're going to go, whoa, I'm ready.
Mhm.
And then you can just do it, right? And so if you have a big day at the office, if you're talking to people all day, sure, your tongue is going to be a little bit blue. And what we say
Yeah.
in prescriptions is that blue is the new smart. So it's not why my tongue is blue. It's why your tongue isn't blue.
Oh, I love that.
Yeah.
Blue.
So,
you keep talking. I'm going to post that. Blue is the new smart.
yeah, blue is the new smart. So remember, blue is the new smart. And that's why we really, in the beginning, we knew it was going to be an issue because not everybody wants a blue tongue. We get that. But when it comes to blue cannatine, this combination, it's so powerful, so effective that it really is worth having a blue tongue for. Absolutely. And we're using it in anybody from, college age to elderly, really, because everybody in between can benefit from this. And you were asking in the beginning, when you want to take it or how often. This
Yes.
typically, blue cannatine is not something typically people will take every day unless they have a specific issue that they're addressing, like ADHD. So if they're using it as a replacement for some of those other medications with the consent of you or their practicing physicians, of course, or their supervising physicians, then you can use it every day. Okay. Absolutely. But if you're using it more for kind of targeted focus, then you can, on average, our users will probably typically use it maybe 3 to 5 times a week kind of thing. Mm-hmm. Our next product, our Methylene Blue only product called Just Blue. This one is what I would call our daily health optimizer, our daily health optimization supplement, because most people these days, especially if you have ongoing symptoms of fatigue, of brain fog, autoimmune issues, fibromyalgia, chronic fatigue, mild cognitive impairment, or even further cognitive impairment, or even joint pain, inflammation, Methylene Blue is going to support the system while you're doing the more challenging work of optimizing over the long term, because it's optimizing mitochondrial function. So it's going to help energy production, help you feel better because you're making more energy. It doesn't give you like that major focus that blue cannatine will, but it gives you a lift. And you'll feel that lift. It'll be subtle, but you'll have more endurance. You'll have more brain power. You feel like you'll get fatigued not as quickly often. So like in a lot of my post-COVID patients, for example, this has been a lifesaver. And it really does help because some people can't tolerate the stimulants. They can't tolerate the nicotine or the caffeine, but they can tolerate methylene blue because it's not a stimulant. It's just supporting the system. And then there's also some evidence that it's as powerful as taking an antioxidant like glutathione or vitamin C. So we know it's super powerful. And the cool thing about taking Just Blue is that, yes, you can dissolve it in your mouth. And I do recommend that if you have brain fog, if you have cognitive issues, but you can also just swallow it as well on an empty stomach, because methylene blue is as powerful if swallowed, because what it does is it goes where you have the most mitochondria that need it. So if you are a runner, if you're an athlete, it's going to go to the mitochondria in your muscle tissue, and it's going to give you more endurance. If you are having more brain fog issues, it's going to go to your brain because that's where your mitochondria need it the most.
That's fascinating. Yes. And I did not know we could swallow it until I was in New York, and I swallowed it. And then my pee was like blue, green. And I was like, what in the world? But now I got to tell you a story about this. You need to tell Dr. Ted this. I ended up in the emergency room last week, and I hadn't been in the emergency room in 25 years since my kids were babies. Diverticulitis, acute case of diverticulitis. I thought I was having an appendicitis, drove myself to the ER, but I had just swallowed one of these. And I think I swallowed the whole thing. I think I did. Well, I had swallowed it. I was in so much pain. But anyway, I thought, well, maybe this will help or what. I don't know. I just never dreamed I was going to end up having to have a CAT scan and all this. But they needed they needed a urine sample. I went to the bathroom and I thought, and I had totally forgotten I'd taken this, but I had blue pee to hand them. And they were like, what in the world? I said, it's methylene blue. Never mind. Just get me fixed. Yeah, but it was funny. So,
oh my goodness.
Don't take it right before you end up going to the emergency room for sure.
So to be clear, for your audience, you took it because you were worried about the pain and just taking something to try to help, or how did you?
No, I took it earlier in the day because I was trying to focus. And I wanted to focus, and so I didn't have the Troblo. I couldn't find the Canatine one. So anyway, that's the reason I took it. But now that you said it goes to the places it needed, I don't know. Maybe it kind of helped me a little. If maybe it went to the gut.
Well, the thing about
the gut, but clearly I was in major inflammatory response there.
Yeah, I mean, it certainly could have helped with the inflammatory response once it started. Yeah, I mean, because I was just talking to a colleague of mine. I was at a meeting last week, and so she had chronic urinary tract infections that wouldn't go away. And all she does is now take low dose methylene blue from us in the troche, and she doesn't, and they haven't recurred since she started.
Whoa, that's huge because I have a lot of patients with UTIs.
So it would be loaded. You can start them on a half a tablet or half a troche a day, or even every other day, and see if it works. Because the thing about methylene blue, as we were talking about, it concentrates in the urine, and as a result of that, the urine is going to get blue, as you noticed in the emergency room. We've had people take drug tests and have the same deal. You don't turn positive in a drug test or anything like that, but it's blue. So the person that's checking your urine is going to think you're positive in something. But yeah, so it was used, and it's still used. There's a drug that's derived from methylene blue that's used as a chronic UTI preventive. And so you can use the methylene blue by itself as a preventive as well. Now, it may not work for everybody, but it seems to have a significant effect on a significant proportion of people that have chronic urinary tract infections. So yeah, I would certainly do it, especially if somebody's in and out of antibiotics or trying to taking cranberry and drinking fluids. And this is something else that really be, I think, a great addition to the regimen of those things.
Absolutely.
Yeah. Okay. I mean, I was talking to somebody else just the other day, another practitioner of mine. Actually, this may be in you. You're talking about it was actually another lady. That's right. She's in Georgia. She's close to you, but not too close because everything's further away. The South is all the South for me. Sorry, I'm just kidding. just kidding. No, she's in Georgia. So she was telling me that she gives the Pure Blue, the Just Blue to her ladies between 55 and 75 years of age with chronic fatigue syndrome and fibromyalgia. And they take it, they're able to get off the couch, they do the dishes, they're able to go do the vacuuming. It gives them like a nice burst of energy while they're taking it as well. So, and this is because it's decreasing inflammation. So you can certainly play around with your autoimmune patients using the Just Blue as well.
Yes, absolutely. Well, of course I do. I have a lot of autoimmune and Hashimoto's.
Yes, and we'll do a trial on that. So I know you're in the process of getting some, because I think from the limited experience that I have so far, what happens when you take methylene blue is that it's revving up, or it's optimizing your metabolism. Okay. And so as a result of optimizing your metabolism, your thyroid's going to work better too. If you have less inflammation, your thyroid numbers seem to get better when you take methylene blue at the same time as obviously doing all the other things that you're doing for Hashimoto's as well. So, but we'll see. We'll do a bigger cohort and see what happens with your crew.
Absolutely.
Yeah.
Okay, continue on.
So I mean, when it comes to Just Blue, it's a big bucket of people, but methylene blue, as we were talking about, has this storied history of being an antimicrobial and then being a mitochondrial optimizer, helping with your energy and your resilience, increasing your antioxidant capacity. So really what it comes down to is it can be supportive for almost anybody. The only thing about methylene blue you got to worry about, and this is a rare type of risk, is that if you're taking a SSRI, an antidepressant medication, there could be an interaction between a high dose SSRI and taking methylene blue. So the studies that were done were on very, very high doses of methylene blue and very, very high doses of SSRIs. So the risk is super low, but it is just something you want to be aware of, and probably to talk to Danny or your practitioner about whether it's a good thing to combine. I mean, I've spoken to a number of psychiatrists that use them in combination, actually. So the first antipsychotic drugs were actually derived from methylene blue, because not only does methylene blue work on the mitochondria, it also increases neurotransmitters in your brain. So these are the brain chemicals that do your various types of signaling. Okay. And so they have one called norepinephrine, which is kind of like your stress hormone, but also the one that gives you some focus, gives you drive, increasing dopamine, which is your reward transmitter, and also increasing serotonin, which increases and supports your mood. Okay. So methylene blue also has the ability to do these things. And so oftentimes what I'll find when people start taking it is that they also get a mood boost at the same time as they're getting an energy boost. So it's a great combination. And it's being studied as its own antidepressant as well. But it's not studied in large amounts because it's already an off-patent drug. So there's not very much that the pharmaceutical companies can do with it, except for try to change it into something that they can patent as usual, right? So there's the mood boosting capacity of methylene blue and Just Blue as well. So it's got this long arc of history where there's lots of ways we can use it. But if you're having, and this is for you, Dan, if you're having anybody with mitochondrial dysfunction, and even if they need a little bit of a mood boost, but you're worried about going on antidepressants and things like that, methylene blue is a fantastic option for people while they're trying to do the harder work of optimizing their selves and their bodies and minds.
I'm telling you, I've got to add this tonight to my post-COVID protocol that I use with D-ribose and L-carnitine and CoQ10 and some things that I have a great post-COVID protocol I use. But I'm going to add this.
Yeah, I mean, there's controversy around this organization, the FLCCC, but they also have it as part of their post-COVID protocol. Actually, they have it might be for their post-vaccination injury protocol specifically. And I've used it a lot in that way as well with a lot of my clients over the last several years too.
Okay. All right. It's part of my new one. Okay.
Yeah. So add in, as with all these things, you can titrate our troches, right? So you can start off with a quarter, with a half, with a full. Now, the only other, as far as other reasons why you don't want to take methylene blue, let me finish off on that, is that if you're pregnant, you shouldn't have any methylene blue. If you're breastfeeding, shouldn't take methylene blue as well. And those are the two other major things. Now, the one side effect that people may have when they take methylene blue, I found, and this might happen in some of your more complex patients that have more oxidative stress or more inflamed, is that they may get symptoms of, in the Lyme world, we call it hertzing, right? You might get some mild detoxification kinds of symptoms. It could be mild headache. It could be mild GI distress. It's usually mild. And if that happens, I just dial down the dose to whatever half that they took before. So sometimes in some people, it'll be an eighth of a troche to start off with, really, and just building up. I mean, if they get a headache with a quarter, some people will get a headache with a quarter of Just Blue. Usually that headache will get better over the first couple of days. But that's really the system trying to, think about this as like, your brain's like, holy shit, I just got more energy. I don't know what to do with it. And then it's going to spasm the blood vessels a little bit, trying to get more of what you need to make energy up there. Okay. And so I'm being as lay as I can about this. And so as a result of that, you get your blood vessels, when they start spasming a little bit, that's when you get a headache. That's what headaches, one of the major reasons of headaches is when you get spasms of blood vessels. And so we think that's probably what's happening with methylene blue. And the mitochondria are like, holy shit, this is amazing. I'm making so much energy, but then I don't have enough of the things that I need. It's called your substrates, like the building blocks of how you make energy. Like you need all that stuff to get to where it needs to go, but it's been a while since it needed to go to those places. So as a result, your brain's like, holy shit, hold off, dude. Let me get used to this first, right?
Hold off, dude.
Yeah. Come off and give me a quarter. Or if you were taking a half, take a quarter. If you were taking a quarter, take an eighth, and then just build up over a couple of days. So, and that's the major side effects. Really, the major side effect that I've had reported for this one has been headache, and that usually gets better over the first couple of days.
I never had a headache at all. I mean, like at all. I must be.
Nor do I. Yeah.
Yeah.
You'll find that the more optimized you are, the more you're going to feel better taking methylene blue quickly. Sometimes it can be a little bit of time. So it's not like, and people have to give it time too. And it can be subtle. So when you're first starting methylene blue and you're optimizing for mitochondrial function, mood boosting, you will see an effect. But if you're not completely plugged in, so most of your male patients, for example, won't have any idea that anything's different, but their wives be like, well, holy shit, he's thinking better now. He's got less brain fog. And he'd be like, maybe. you know how guys are. But and this is typically how it goes. It's a rear view mirror thing for guys when it comes down to it. But for some people, it can be almost like night and day. Like you take it, you're like, holy shit. Like, I can't believe how good I feel. but other people, it's going to be more subtle. Like I had somebody, like a client of mine, a previous patient in San Francisco where I used to live, he took methylene blue. He's like, the next day he's like, my joint pain's gone. My brain is firing. What did you do to me? I was like, well, how much do you take? He's like, I just took a half a troche. I'm like, that's all you took, you know? And I have, and so I've also had some reports of blood pressure going down too, taking it as well. So, I mean, you just don't know when inflammation goes down. Sometimes it can be, okay, let's do the hard work of optimizing the system. And other times it could be like, fuck yeah, let's go. You know, excuse my language. I think I'm good.
Yeah. Wow. Okay. This is, I mean, it's fascinating to me. Okay.
Yeah.
So that's methylene blue.
Yeah.
We know who can't use it.
Right.
And with caution with antidepressants, and ask your provider. Of course, you know, if your provider's not me, you know, they're going to be like, what in the world are you talking about?
You're coming in with blue urine and they're going to be all confused. Yeah.
What about this Trocom?
Yeah, so this is actually
tell you about Trocom,
ladies and gentlemen.
Before he says something about this. So this is our CBD that we use here. We use a really great, clean company out of Kentucky. So I had a little urology procedure a few weeks ago, just, you know, stress incontinence. You don't even know all this, but just a little bit in office. My insurance would not pay for it. So my urologist is a buddy of mine, and she's the best there is, Dr. Tara Allen. So she chose to let me do it in the office. It was supposed to have been done in the surgery center. Yeah. And sometimes they put you to sleep or they give you propofol, whatever. So they gave me some laughing gas, but I was nervous because it goes in the urethra, right? These needles do. It's a bulking procedure. And I used our CBD, which is fantastic. And I took a full friggin' Trocom because I knew this was going to be intense for 5 minutes. Let me tell you, I was high as a kite, as in good, in a good way, before I ever got the laughing gas. I don't know that I needed the laughing gas, you know, and I was self-induced, the laughing gas, you just could do it. But this stuff works. Before I gave my presentation in New York City last month, this is what I took, this combo right here. But I wasn't off my A game, right? Because that's what I was worried about, that I was going to be like just out there. Tell us about Trocom, because it's a big deal.
That's a beautiful experience, Danny. And we have a lot of people, a lot of clinicians that are using Trocom before surgical procedures, you know, minor ones, and especially dentists. Actually, you know, dentists know that people get worried about them coming to the office and getting drills and whatever else. And so we have a number of dentists that are using Trocom specifically before their patients get their dental procedures. And the cool thing about it is, as you described, it is titratable. So a quarter, a half, a full. And when our brain is super stressed, we can't think. It's the common dream. You wake up in the middle of the night, you're giving a presentation, and you forget all your lines. You forget everything you're supposed to say because your brain is so stressed that blood flow to your frontal lobe just stops and you can't think. So if you can just take a quarter of that, or even a half, just to take the edge down just a little bit, your brain's going to start firing again, and you're going to be able to start thinking, and your presentation is going to flow. And so, I was worried about it when we first developed it too, for the same reason, because you don't want to be slow when you take the presentation. So this is a trick. You don't know this one. This is a trick. The trick is one side blue carnitine, other side Trocom.
What? Oh my gosh.
That's the trick. Yeah. Because the trick with that is that you have the focus, the concentration with the nicotine, caffeine, and the methylene blue. And then you're taking and you're giving a little bit of CBD, a little bit of GABA, a little bit of relaxation at the same time. So it's like, we call it our what is it called? Our relaxed focus, right? So you have them. So you can also use them in the same day, like an AM PM solution, where you use the blue carnitine in the morning and then the Trocom at night to help calm down. But you can also use them at the same time if you're adventurous, and that's what I do sometimes. Because
I'm going to try that. I have a big presentation Wednesday night at a university here in town to a bunch of students, so they're not going to care if I have a orange and which these are my high school colors, orange and blue. So I'm fitting right in for homecoming this year.
That's perfect.
Okay, talk about this Trocom, because
for sure. So Trocom is a combination, CALM-bination, right? Combination. Play on words, of course. Come on, got to do it. That was a bad joke. Probably my worst joke of all year.
That's great.
Except for one of my dad jokes that I probably did earlier today. But anyway, so it's a combination of kava and CBD. And so it sounds like you already have CBD in your stores, or your group knows about CBD already. Kava is really great because kava helps work on the most important neurotransmitter, that brain chemical that helps relax the firing of your brain. And it's called GABA. And the other thing that we have in there is actually GABA itself. So we have kava, we have something called nicotinyl GABA, which is a very permeable type of GABA that helps get into the brain, helps calm it down, on demand immediately, right? So you get the feeling of relaxation, calm, decreasing your stress and anxiety. And then we have the CBD, which I mentioned, and CBG. And CBG is a really cool cannabinoid. I don't know if you have it at your store as well, Danny, but CBG is a really great non-psychoactive cannabinoid. It comes from the hemp plant, so it's not going to make you high. If you want that, we have other drugs for that coming down. Just kidding, later. So
you guys can see why I love him. This is a crazy company in a good way. Like they are.
It's our
smart.
off the books trochees, as we say. So,
yeah,
but anyway, off the books trochees for our retreats and things like that for team building. Okay. But anyway, so CBD, CBG, kava, and GABA. And so those four things in combination will relax you, will take the edge off. And then if you're having like a real serious, anxious moment, you can take more. So a half, a full. And so I had some back spasms a couple months ago, along with taking other things. I took a full Trocom because it's going to help relax the system, right? And so we use it as a replacement for things that are very addicting for people, like your Xanax and your Valiums and your Ativans and things of the world. Now, you don't want to stop any of those medications without talking to your doctor if you do take them. But if you are taking those and you want to get off them, which everybody should try to get off those things because they give you a higher risk of dying from anything. This is called all-cause mortality, which is, anything you can die from, you're going to die from more if you take those drugs.
That's
so
right.
For my patients, this is why we developed it, right? We wanted an alternative for people that didn't have tolerance, any issues, withdrawal, dependence, those kinds of things. And so we really wanted to make sure we had something that could work immediately and for really anybody that needed it immediately, right? So if you had anxiety, this is going to help you now. If you're having stress, it's going to take the edge off. Instead of going to the glass of alcohol or the glass of wine or the 2 glasses of wine, the 3 glasses of wine, the 10 pints of liquor, like that's all bad stuff, right? I wish alcohol was illegal and everything else wasn't sometimes is what it comes down to. But anyway, alcohol is going to trash your sleep. It's going to trash your next day. And this is not going to do any of those things. It's going to increase your deep sleep. It's going to help you fall asleep faster, especially if you're like me and others around that can't get your mind to shut off before you go to bed. If you have a hard time with that ruminating, perseverating mind, this is going to quiet your mind. Dr. Ted calls it thought stipation, like constipation for your thoughts.
Yes. Yeah. He said on our video, this will constipate your thoughts. And I
there
had
you
to
go.
think about it for a minute. I was like, what? And I was like, oh yeah. Yeah.
No
slow
thoughts.
it down. He says it's good for sex. I mean, is that
performance anxiety? Yes.
Performance anxiety. That's
so we call
it.
We call it. Yeah.
I wouldn't know. It's been so long. But anyway, onward.
Performance from the boardroom to the bedroom, Danny. That's what we say.
From the boardroom to the bedroom, man.
And we're talking about sex. And sleep.
All right, this is fascinating. I agree with Cindy McKinney on here that this is fascinating. So yeah, let's keep talking about this one because this one, I mean, again, you could use it every day or just as needed or.
Yeah, both. It really depends. If you're using this for clinical or real issues with stress and anxiety, you need to be talking to Danny about optimizing your health. There's other supplements that are really going to help you. Stay away from Amazon, like we talked about. But at the same time, if you need something as a supportive to help you now, this is going to help you. So people will sometimes use it just a couple times a week. Other people that have a hard time going to bed will use it as part of their sleep routine. And you want to take it about an hour and a half before you go to bed so that the troche is fully dissolved. And then you let the troche fully dissolve, brush your teeth, go to bed, right? And so you have your sleep routines that can really fit really nicely into that as well.
Okay. So about an hour and a half before bed. Britt, who's our supplement store buyer.
Yes, Britt, of course.
She uses it before she meditates. She says it's great before meditation. It's
amazing. And so it depends on your meditation practice. For me, I like methylene blue specifically, because methylene blue, especially the carnitine, helps you focus. So if you're one of those people that like to do like a focus practice where you're focusing on your breath or focusing on an object or something, a concentration practice is going to be easier taking blue carnitine. Now, if you're looking to use meditation as a way for like anxiety and stress relief and calming down, then meditation with TroCalm is fantastic. But it may be harder to maintain your focus depending on how much you take. So it just depends on your meditation practice. But we actually designed all of these troches specifically thinking about energy centers and all that kind of woo-woo stuff anyway. So that's a little side note. So we're always thinking about that. And the colors do correlate to your energy centers on some level as well, interestingly enough. So.
Oh, wow. Hey, we have a lot of questions here about children.
Okay.
So hang on a second here. Can you give it to children?
So the answer is it really depends on the comfort factors of your practitioners. As a company, we don't sell the products to anybody that's less than 18 years of age. However, I work with multiple practitioners that use it in kids, but they do it. So Methylene Blue is, just so you guys know, it is still on the World's Health Organization's list of essential medications. And it's used for malaria again. Actually, after many years of not being used, it's now being used for malaria again. So it's very safe. But of course, you just want to be doing this in combination with talking to your practitioner about it. But so yes, they can be used in children if the clinician that's using them feels comfortable doing that. And so like my father, for example, who's a chiropractor in New York, he works with a lot of children and he uses it with kids all the time and has a lot of success in his autistic populations, for example, that like have a lot of stress, ADHD kids as well. But again, the comfort factor is not, with me, it's really with the practitioner that you're working with. And
Sure.
But of course, I talk to all the practitioners as well. And so I get feedback from my father, from other people that are working with our products. And then of course, I can help you, Danny, in helping understand who those best populations would be.
I was listening to a podcast today and someone to something today, I don't know, and talking about autism, the autism population with Methylene Blue and how incredible it is. What about Lyme disease? That somebody on here asked this early on and I didn't want to ignore you. Oh, is it great? Oh, maybe they're saying it's great for Bartonella. Is it?
Yeah, so there's good data that it breaks up biofilms in Bartonella specifically. So the dosing of Methylene Blue for that particular organism is higher than we put in our troches, though. So just be aware of that. Although what I found, Danny, is that the problem with a lot of Methylene Blue out in the market, this goes back to what we were talking about, it's not as strong. And even though it says it's stronger, people have much more of an effect when they take our troches because we're doing pharmaceutical grade, we're easy to titrate. The other way that most people are getting Methylene Blue these days is in droppers. And the droppers are messy, they get all over the place, they're hard to dose. And so people just have a hard time with those. But what I'll sometimes do, and this is actually something that we'll be doing soon, I think as well, I think I can talk about this, is that we're actually looking at creating a practitioner only line where we're going to have a little bit of higher strength and things to kind of address these kinds of issues. But right now, for Bartonella specifically, yes, Methylene Blue can be used. The dosing that we have a little bit lower than you would want to potentially do, but you could start at our dosing and maybe titrate up and use our troches because we know it's a great source, obviously.
Huh. Okay, I didn't know that. New uses for methylene.
In the OR. Yeah.
In the OR. Oh, so this is great. All right. I don't know if this is Julie on here, not just as Facebook user, but
my friend who's a transplant surgeon, they'll use it in the OR as well. Because it's a dye, you can see very quickly if you've injured somebody's bladder, doing a surgery that's around the bladder, for example. So they'll put in Methylene Blue into the bladder itself, and they'll see if anything comes out of the bladder. They'll look for the blue, and that's how they can see. So there's ways it's used still, yes, in surgical procedures.
Yeah. And I think in the lab too, don't they stain things with it? I mean, Can
you use the mitochondria?
Yeah, that's right. Yes. Or we did talk about this. I don't know if you heard it or not. You can use both. Well, I don't know. You may have been talking about the blue, but you can use, but this is going to be amazing for me. You can use the TroCalm to constipate your thoughts, I suppose, but calm you down,
right?
But still have clarity and, get rid of that performance anxiety, whatever it is you're doing in front of a stage, on a stage, in the bedroom, whatever, but then also to focus in. So
Yes,
so
exactly.
you can use both, and you would use, so,
I would
okay.
do a quarter, like a half of a blue canatine for you, it's still the
Yes.
same, and then just a
Yes.
quarter of the Trocom. That's what I would do, or even an eighth. You can even play around with it and see, and because you just like a little bit of that edge off while you're still totally focused, totally on, totally ready. So I play around with it, but it also can be used as an AM/PM kind of solution where you take the blue canatine in the morning or like the early afternoon to focus, get stuff done, be productive. And then in the evenings when you're winding down, you can take the Trocom. That's how most people will use it. But I wanted to get fancier for you with the blue and orange at the same time.
Oh yeah, I'm going to try it. I'm going to see what happens. Now, the Trocom, can
Yeah.
it be used with children?
So same thing. There's no ingredients in there that are not safe for children. Again, we don't sell the products to children directly, but if the practitioner feels comfortable, then yes, we've seen some good success using. We've heard of reported really good success using the Trocom. Like we were talking about in the autistic population, for example. But I also, we've had a lot of success with Methylene Blue as well, actually. So I was talking to somebody on a podcast recently. She gives her autistic daughter that's 14 the Methylene Blue, and she loves it. Her brain is like on fire. She's not verbal, but she can communicate in other ways. I think she's blinking actually, and then she loves it. She's so much more creative when she takes her Methylene Blue.
Wow.
Yeah.
Okay. I have a few nonverbal patients that would be excellent to try. When do you anticipate having the insomnia sleep troches? Oh.
Yeah, so we're getting fantastic results with this one. And again, it's all going to be ingredients that work on sleep in various ways. So there's people that have a hard time falling asleep, there are people that have a hard time staying asleep, and
You
there are people
bet.
that have a hard time waking up because they're groggy. So we're working on all three aspects. This is like the Ferrari of sleep supplements is what it comes down to. And we're really excited about it. I'm hoping that it'll be ready by June. That's our hope. But I'm hoping I get you some advanced ones first to test with some of your patients, Danny. So maybe you'll find some lucky
Kathy, you'll
patients
be
to try.
one of those. She's one of my long-term from years and years ago. I have 1, 2, 3 shelves of sleep stuff in
I'm
this
sure you do.
office. That's how discombobulated people are with their sleep, right? I
Yep, I
mean,
know.
it's like we have to try so many things with people. So I'm very excited about that.
Right.
And I mean, I'm excited to try the Trocom for sleep. I sleep pretty well, but I should actually do it now because I go to sleep so early. And
Again, if you have a hard time falling asleep, it's going to help you, but it won't help you if you have a hard time staying asleep, because it doesn't have everything in there to help you stay asleep.
okay, then that makes sense because I did try it one time and I told the girls, I said, I didn't sleep, but I am literally asleep. My aura ring says I have a problem. I'm asleep before 3 minutes. So it tells me I'm extremely tired, but I'm not extremely tired. I could lay down right here while you're talking and go sound to sleep.
It's a superpower. Yeah, I really do
It
believe
is
that.
a superpower.
Yeah. My
So,
wife's the same way. I'm jealous.
Chris Powell for the sleep test. There we go. Absolutely. Yeah, I have lots of people who will be right on top of this.
Yeah. Well, what we'd want to do is have people have their rings if they have rings so they can track their sleep too.
Oh, fantastic.
Yeah, I have a friend of mine that I just gave one of our early samples to just this last week when I saw him. And he's been having issues like for the last 2 months, waking up every morning at 2:00 in the morning. So he went to bed at 10:30. He woke up at 5:30. He didn't wake up. He's like, his one word was impressive. So like he hadn't been able to do that in a long time.
Well, if that happens to me, then I will. Yeah. If that happens to our patients, hey, tell me this. Do you, or what, one other contraindication would be veneers. If you have veneers, am I correct on this?
Sure. So yeah, if you have plastic veneers, you don't want to take Methylene Blue. That's a really good point, right? So yeah, because it's going to stain them. Yeah. And for dental stuff, people do get worried about that. But if it's porcelain stuff in your mouth, you're fine. If it's anything plastic, do not use it. And if you have braces, it's not a great idea to use the Methylene Blue because you get stuck everywhere and all those kinds of contraptions. So, although some people can use it with braces if they don't have any plastic in their mouth. If it's just metal, it will go away. But be aware of that too.
Okay.
Also, with Trocom, you don't want to use Trocom if you're pregnant, if you're breastfeeding again, and also if you're drinking alcohol, you don't want to combine it with alcohol. And then if you're using anxiety medications, just do, if you can titrate somebody down off their anxiety medications using Trocon, but it has to be done like with a practitioner supervising, because they're both working on similar neurotransmitters. So
absolutely. Absolutely. My only complaint about Troscriptions is that there's not enough in here. There's only 16 if you quartered it.
Yeah.
And I clearly can tolerate a full one and not have any issues. And,
Sure.
and it's great. Are there any things in the works for making more, or is it just no?
Well, part of it also, Danny, is that we want to make sure that people, we don't go over what is safe for somebody to do in a day. Because, especially with methylene blue, we wanted to go, and then nicotine as well. So nicotine up to 4 milligrams a day is safe. Any more than that can, potentially lead to addiction over time. So we did that specifically with the canatine because we didn't want to go any higher than that. But we're looking at options for other ones, especially for the Just Blue, because I think that more people want or need more of that, and Trocom as well. So practitioner lines are coming, and then we'll have higher strength things and things like that. So it'll be better. Yeah.
So here's the thing, ladies and gentlemen. I mean, it's amazing. It really is. And I would never have learned about Methylene Blue had it not been for Britt and Jackson, my son, who's in medical school.
Right.
And they they were way on board long before I was. Britt, actually, she has a family member who has ADHD, and he tells her he takes Adderall or took Adderall or takes it, that the canatine, blue canatine, works equally as well for him. Now, I'm not saying everybody, as Adderall.
Yeah.
Without the jitters. Right?
Yeah, one of the guys on our team, same thing, was on Adderall for years and years and was able to wean himself off using the blue canatine specifically. So I think there's a lot of potential there. And I'm talking to clinicians all over the US that are using it that way. And I thought our biggest seller was going to be the methylene blues, but it's actually our biggest one is the blue canatine for clinicians as well.
Really?
Yeah. I mean, the Just Blue works great, and we have a lot of people using it. But I was just shocked at how many stories that I was getting on this very topic, on taking people off of ADHD meds. Pretty amazing.
Yeah. Well, it's not an ADHD med deficiency going on in your body, right? So, I mean, most of us weren't born with that. So
Indeed.
I'm a big believer we turn this stuff on. So listen, so I was looking at some of the people who love Methylene Blue today. So you guys all know who Dave Asprey is, right? He created Bulletproof Coffee and all that. And I mean, I learned a lot from Dave, and he's actually on their podcast, which is great. He says, Methylene Blue is one of my favorite biohacks and mitochondrial enhancers of the last 20 years.
Yeah, he was an early adopter.
He's a good one. Yeah, he was early on this. He usually is on stuff. Ben Greenfield, who's one of my favorites, and the Ben Greenfield podcast I love. Blue canatine is one of the best, most well-formulated yet unique nootropics. Yeah. Nootropics. Okay. I've discovered. If you haven't tried it yet, you absolutely must. You'll be blown away by the results, especially when combined with sunlight.
Indeed. Yeah. So methylene blue is activated by sunlight. So they work on the same part of your mitochondria in your cells, and they both basically just make you more energetic. They give you more energy currency in your cells. And so, yeah, great thing to do when you get a chance is take your blue canatine, go out for a walk. You're going to feel like $1,000,000. The Just Blue, same thing. It's a really great combination. So sunlight, red light therapy, either one, plus methylene blue is a fantastic combo.
I was learning about it today with red light therapy and cancer.
Yeah.
I was listening.
Yeah, higher doses of methylene blue are being used that way.
Right. Yeah.
With very specific type, with very, like it's called photodynamic lasers. So really high intensity lasers and things, and very cool. And then of course there's lasers that you can go into your veins and, methylene blue that way and things like, but it's very, for what we're doing, what we're talking about, there's a lot of potential for just the combination of the canatine and the Just Blue and sunlight and red light.
Man, this has been fascinating. Tell me this. So if people are complaining about their blue tongue, which mine is kind of gone, what's the best way to, baking soda, toothpaste? What do you tell
Sure.
people?
So first of all, blue is the new smart, as we said, right?
Yes. So blue is the new smart.
So flaunt it. But of course, not everybody can have a blue tongue for all that long. So as I mentioned, the Just Blue, the pure methylene blue troche, you can swallow that and you can get this the mitochondrial benefits the same as if you were putting it in your mouth. It's just going to happen a little bit slower than if you put it in your mouth and let it dissolve here. But if you wanted to go way faster, so baking soda is probably the easiest one because it's a sodium bicarb that'll actually help neutralize. So baking soda, and you can actually mix it with a little bit of vinegar, interestingly enough. And the baking soda and vinegar, it tastes terrible, but it will help it go way faster. I just typically will do baking soda because baking soda is good for you anyway. It gives us more, giving us more sodium bicarb is not a bad thing. And also hot drinks, so hot coffee, hot food, that'll typically make it go away faster. And what am I missing? Oh, there was something else. If you're worried about having blue urine, you can also take a high dose of vitamin C after you take it as well. Like 2 grams of vitamin C will turn your urine back to the regular color as well. But
really?
I don't typically have people do that because I'm a little bit worried that might be counteracting the effects of the methylene blue itself. So in general, eating and hot foods, baking soda are your main things. And we have something on our Instagram page that I can point people to as a link for all the ways you can decrease the blue.
I didn't know that. Okay, they have a fantastic Instagram page, by the way, guys. Scott, I appreciate you so much. Thank you. Is there anything else that we need to know that we don't know? Right.
I mean, I think we covered cover most things other than how awesome you are, Danny. So thanks for having me. And thanks for, doing what you do to help so many people down there in Tennessee. And I look forward to eventually coming to see you and Britt and taking some of your other supplements and bringing you some off the book trochees to try
it's going to be fun. I can't wait. I can't wait to show up here in Tennessee. Well, I'll show you. I am a good tour guide, but
I don't doubt it.
Guys, listen, if you have any questions, if you're watching this later, if you're watching this on YouTube right now, if you have any questions, it'll be on every Facebook community. We have post your questions up there. And if I don't know the answer, then, I'll find out.
Yeah.
I'll find out the answer. But here's the thing. Tomorrow here in the office, for those of you that are watching live right now, the gallery, the multi-cancer screening test that won one of the greatest inventions of 2022 in medical and health for the Time Awards. They're going to be here in the office 10 to 1 tomorrow. I've got the regional manager, the direct, we've got big wigs in here tomorrow, 10 to 1. They're drawing blood for the gallery multi-cancer test. I had my test done. Have you done that?
Not yet. No, I just signed up. I think about a month ago. So
it's a fantastic test. It looks at 50 plus cancers. We only screen for 5 cancers: breast, prostate, lung, colon, and cervical cancer. We don't have a screening for pancreatic or, bone cancer, stomach cancer, none of that. This test looks at 50 plus cancers, the methylation signals in your body, and it catches stage 1, 2, or 3s, right? So when you catch a stage 1, you've got a greater chance of living with pancreatic cancer than when you catch it at a stage 4, because we don't have a stage 5 cancer. So we offer the test in here for people. You don't have to be our patient, but they're coming in tomorrow and they're drawing blood. We draw blood 5 days a week here for this test anyway. But if you have any questions, show up 10 to 1. It's free to come and learn. They take your HSA. They charge you over a year. It's $949. It's not cheap. But as the patient told me the other day, her mother died in 8 days of pancreatic cancer. 8 days. She got a diagnosis on, say, today, and she died the next 8 days later. And I said, it's expensive. She goes, you know what's expensive? Cancer and death. And I said, okay, yeah, you're right. So they're coming tomorrow. And then Tuesday night, we're having a Tuesday night service instead of Sunday night service. I've got the CEO of Berkeley Life, nitric oxide, coming in. We're doing Sunday night service on Tuesday. And then they're coming in here on the 29th, and they're doing a 4-hour nitric oxide night here in the office. It's called our first annual Sips and Sups. We're going to be drinking clean crafted wine if you want it, sparkling water, and then nitric oxide. We're going to be testing ourselves and doing all that. So it's going to be a ton of fun. And It's National Sleep Week. Actually, it's not. It was last week. I was a week behind because of the hospital situation. So check our online store. We've got all kinds of specials for National Sleep Week because I'm a week behind. So there we go.
I'm glad you're feeling better.
Lord, that was awful. This time last week, I thought I was going to die. So
Yeah,
I did, but I appreciate you so much. Look here. Thank you, Nancy. Yeah,
Thanks
he
everybody
was
for listening. Yeah,
wonderful.
thanks for the good questions, and this has been a lot of fun. Keep rocking down or keep going country in Tennessee,
We're
whatever.
going country.
Yeah,
We
going
are
country.
straight up country down here, and I'm
Okay,
proud
keep
of
rocking
it.
in Tennessee, but keep going
If you
country.
don't believe it, you can listen to my book on Audible because I read it. And that is one redneck girl reading this
Love it.
wild and well. 11 hours of that. That was the hardest thing I've ever
Oh,
done.
I
So
can't imagine. But
that was
congrats.
awesome.
Awesome work, Danny. All the
All
best to
right.
you,
Appreciate
your
you
team.
guys. We'll see you later.